natural disasters. Wars and other man-made crises, epidemics, are major threats to health and development, especially of poor countries. But countries can prepare against disasters, and their capacity to respond when they do occur can be strengthened. The challenges are always complex, but experiences in various countries show they can be met and lives can be saved. Successful responses to emergencies depend first of all on national preparedness. Key elements in this are healthcare facilities that have been strengthened to withstand the impact of earthquakes, hurricanes, or other natural disasters. After an earthquake, the local hospital becomes the focus of treatment of victims. But if it has collapsed, as happened in Mexico in 1985, or the wind has blown the roof off, the health workers cannot do their job of taking care of the victims. And electricity, water, communications, and roads need also be strengthened so disasters don't leave the health facility unable to function or inaccessible. The most effective response is provided by organized local communities. International assistance can be useful when it supports and complements local efforts. WHO has helped many countries cope, dispelling myths and focusing on realities. The myth that any kind of international assistance is needed immediately after a disaster is harmful. The reality is that a hasty response not based on an impartial evaluation may only add to the chaos. It is better to wait until real needs have been assessed. Another myth is that foreign medical volunteers with any kind of medical background are needed. The reality is that only medical personnel with skills not available in the affected country may be needed. The local population often finds new strength during an emergency, with thousands of volunteers usually appearing spontaneously and offering to help in the aftermath of a natural disaster. Countries in crisis require the joint efforts of quick response teams and long-term development experts, working together to help countries overcome both the immediate and continuing challenges. World Health Organization is clearly the best positioned agency to provide countries with technical collaboration in all aspects of public health, including response capacity. Whether it involves Angola or Afghanistan, Iraq or Liberia, Algeria or El Salvador, Colombia or Turkey, countries face similar challenges in dealing with disasters and complex emergencies. The demands vary quickly and significantly over time, are specific to the actual situation, and are in a variety of public health areas. Countries in turmoil don't need to create the best foreign intervention team. Those situations require brokers who can access quickly the vast expertise available globally to prepare, respond, and mitigate. Acting globally so that countries can respond to crises locally is the best way to meet the challenges of these countries. Disaster mitigation is possible even in low-income countries, and strengthening health systems so that they become more resilient in the face of crises is a strategic priority for development, for response, for preparedness, for human life, and healthy livelihoods.